Well, welcome everyone to the California Coalition for Blackbird Justice, our like one of our first lunch and learns. So just want to welcome you and just let you know that today we're hoping you will walk away with some practical tools, clearer referral pathways, and stronger connections for our birthing families. So, for those who don't know, my name's Natalie Champion, and I serve as the Operations and Strategic Partnership Manager for the California Coalition for Black Birth Justice. And just for those who don't know about the coalition, we serve as a statewide organization that connects and convenes the Black birth justice workforce, and we also work directly with healthcare organizations to improve birth equity. Today's session is really focused on how we connect birthing families to housing resources, specifically renter protection, homelessness prevention services. We know that a lot of housing stability is like a core social determinant of health, and it's actually deeply connected to maternal and infant health outcomes. But we also know that sometimes these institutions are siloed. And so we're trying to be a bridge to like bridge that gap and convene folks together so that we can strengthen the Black birth justice workforce. I'm hoping today we walk away with some stronger connections and just knowing the coordination and collaboration needed to really help our birthing families. We have three incredible speakers that I'm going to introduce shortly that will help kind of navigate us through the different resources that are available. So first, I have Kevin Umana, who is the Housing Project Coordinator with the South Bay Cities Council of Governments. We also have Addie Ajidolaiya, who is the Program Manager for Homeless Services with the South Bay COG. And lastly, we have Yvonne Golub. Golub? Okay, perfect. Okay. And she's with Hero, and she's also a Cal AIM consultant. So please feel free to ask questions, use the chat, raise your hand feature, and I'm going to go ahead and pass it over to the housing team.
Thank you for that introduction, Natalie, and thank you so much for having us. We're really excited to share a lot of the resources and tools that we have for, families and folks experiencing homelessness and housing or precariously housed. I will go ahead and provide some more context. I always appreciate it when people do it, so I'm going to start us off and just introduce the concept of the organization that we belong to, how we receive our funding, resources that we offer through this funding for both homeless prevention, but more importantly, for some folks, housing retention and prevention. So we can start with what a council of government is. And so a council of government is a regional organization made up of cities and local agencies that work together on issues that cross city boundaries. The purpose of our organization is to share information, develop regional policies on matters like transportation, energy, housing, homelessness. And while each city governs itself, our job is mostly to provide a platform to foster collaboration and partnering to address challenges or barriers that would likely be too big for like one individual city to take on its own. And so we are responsible, I would say, to get a good idea or concept of the jurisdictions that we represent is I always say North Inglewood, down to San Pedro, west of Redondo Beach, and then east as far east as Rancho Dominguez is our like unincorporated area. How we are funded. So I will start with like big picture. So Measure A, I'm sure you all have heard about it, right? Is that half-cent tax that went into effect November of 2024. It was formerly a quarter-cent tax under Measure H. And so it's basically like a transactional use tax, right? Every time you buy something, you're taxed this little extra amount over it, and that amount gets funneled over into a Measure A fund that is $1.1 billion spread out 637 million for homeless services and 340 million for housing, production, preservation, ownership, and homeless prevention. So we're allocated, us at the South Bay COG, are allocated $3.1 million for SPA 8, so our 16 cities, and then our unincorporated areas Then this year, we also received additional funding to fund the housing piece of the work that we do. And that was, I believe it changes a little bit, but I know that it was 12 million total, but 2.1 million, I think, specifically for homeless prevention and a lot of those housing resource stability resources that we'll be speaking about today. So if we go to the next slide, it's just a visual breakdown. I'm a visual learner, so I always appreciate like a visual breakdown of what it is that that we're talking about. So you'll see there at the top, that's the Local Solutions Fund. So that's the funding that the COG receives, right? And many other COGs. There are 5 COGs. We're one of them. St. Gabriel's another of them. Gateway Cities is another. West Side COG. We have 5 big COGs, and then some have direct contracts with the county. So of the three, our 3.1 million comes from this top bracket of 93 million given to COGs and local cities and jurisdictions. Then we have a 625 million that stays with LA County to do, I think, regional resources and intervention for homelessness. And then that 372 million that goes to the Los Angeles County Affordable Housing Solutions Agency. And Kevin works more deeply in that realm of our housing piece here at the COG. So 2/3 stay in homeless services, and one-third goes to prevention and housing production. Next slide, please. And so at the COG, and so the responsible thing to do is delineate between what a homeless service resource looks like and what a housing resource looks like. And so for this purpose, we'll obviously cover both. And so the things highlighted in blue are things funded by that 3.1 million piece that we got from Measure A Comprehensive Services. So those are usually for folks experiencing active homelessness, right? So Client Aid, for example, is a program. It's like a financial assistance program that can be used for a variety of things. So if you know someone that's experiencing homelessness, any population, right? Youth, adult, older adult, family, and they need help with moving assistance. So a security deposit, first month's rent, housing application, furniture, stove, any of that stuff, utilities, reunification, travel expenses, employment expenses. So they need an Uber to get to a job interview, or they need to go to vocational training, or they need money for a guard card. We would be able to fund that expense and fund that need through our Client Aid Fund. For people experiencing active homelessness. There are similar funds for people that are housed, which Kevin will go into detail later. But for folks experiencing homelessness, we have a Client Aid bucket. Then we also have time-limited subsidy, which is a form of short-term rental assistance, also for folks experiencing active homelessness, that can go from 6 months to 12 months to 18 months, depending on the situation. And this is for sometimes a good example that I can think of that came up recently is someone was a seasonal employee somewhere and they got their hours cut and they weren't going to be able to make their rent, right? And so whilst they're trying to figure out how to apply to a different job or how to gain additional income, we would subsidize their rent for, in 3 months increments until they were able to stabilize. And so we also offer that for people experiencing homelessness. And then on our retention side, we have a different program that Kevin will go into. We also offer a variety of case management across our entire jurisdiction. So housing locator and housing retention. It's funded on both right now. It will move to housing, but we do it for both folks, right? So if you need support troubleshooting how to pay your utility or accessing different resources within the county that maybe you don't know of, right? There's so many programs, there's so many resources. It would be very difficult for the average person to keep track of all the different pots of monies and services and resources someone can leverage. So we have specialists that keep track of it all for us. So that when someone's like, I need help with my utility, but I'm in this very unique situation of I've approached this person or I've asked this office or I've done this. What do you recommend, right? We can help them with that wayfinding of, oh, well, it looks like you would likely qualify for one that we have here in the South Bay Toberman, or it looks like you would qualify for this other thing or this other help, right? We have folks that we fund to help folks navigate some of those barriers that are clearly systemic, right? There's so many pots, there's so many chefs. So we try to do a really good job of consolidating it and helping folks get to where they need to get to. And then some of the interim housing opportunities that we fund are motel stays for folks that need a stay in between either an interim shelter or a transitional living placement or a permanent housing placement or reunification with their family. And then share housing to employment, which are I do not appreciate the term group home, but they are like homes that are ran by behavioral and substance use like specialist agency to support folks on their sobriety journey and their employment journey. So they have like peer support specialists on site and group therapy to help folks often transitioning out of, justice impacted settings or substance use rehabilitation settings. It's like a really supportive transitional living placement for folks that need extra support with employment and substance use. And so we fund that as well. And so we have a pretty robust, I would say, and diverse toolbox of resources for folks experiencing active and unsheltered homelessness. And we have an equally as robust and impressive toolbox for folks that are in housing, are interested in retaining housing, preventing folks from falling into homelessness. And Kevin can speak more to that.
Thank you so much, Addie.
Absolutely.
Is it okay if I ask if there's any
Oh,
questions for
absolutely. Yes,
folks? Is
yes, yes,
this a
yes.
good
Please.
time?
Yes,
Okay.
please.
Just wanted to also invite folks, if you have any questions, feel free to raise your hand, your virtual hand, and or put it in the chat. But just
Yeah.
wanted to give a pause. All right. You have a lot of questions your way. Okay, no problem.
And I'll
Thanks,
also drop
Dana.
my email in case for whatever reason we don't get to anyone's questions today.
Yeah.
Please email me. I'm more than happy to answer. Oh, Paris has a question.
Yeah, come on, Paris.
Hi, hello everyone. My name is Paris. I just popped in. Sorry I'm late. I am actually really fascinated with the last bit that you shared, and as far as having resources for folks that are for like that proactive, preventative piece. I find that it's really hard to find services like that, and it's also really hard to advocate for them, especially as the definition for homelessness changes and like when the actual programs can step in and
Yeah.
help. I've actually been told by a service that is a direct bridge for families that I support that like they can't help until like they're on the pavement for the most
No.
part. And that is really disheartening, especially in today's climate where folks are trying to hold it together and like, fight the cost of living and like all these things. So I'm just wondering, um, is that programming through your
Yeah. So
organization? Okay,
Kevin's going to speak more to that because
gotcha.
yeah, I mean for us, we don't need people to be on pavement, right? The point is to prevent
Yes, and I
homelessness.
just love
Um,
that. I love the work that you guys are doing because I'm not hearing or like learning about services like that very often. So that was
yes,
like literally why I wanted to even come to this session and why I wanted to
absolutely.
connect. So I was just really
You're in the
excited to
right
hear
place.
that. Thank
You're in the
you.
right place. We can let well, so we'll let Kevin come on and explain all of these super great resources because we get that all the time. Hopefully not in our jurisdiction. That would be a bit surprising to me since we fund these services. So it would not be best practice for us to hear that a provider is turning folks away, waiting for them to be on pavement. That's like completely opposite to what we do. So hopefully not in our jurisdiction. But even if it's not, if it's outside our jurisdiction, hopefully we can still support you in accessing the right resources so that you're not waiting for folks to end up street based. So Kevin, feel free.
Okay, so take over my slides. Next up, I'll introduce myself again as well. My name is Kevin Umani. I'm the Housing Project Coordinator here with the COG. Um, I joined the COG in September, so relatively recently, but time is flying. And as they say, I guess when you're having fun, time flies, and we're having fun here, aren't we, Addie? Um, but I wanted to go a little bit more in detail in some of the housing work that the South Bay COG, works. And as Addie mentioned, and you can see on the slide here that voters approved Measure A, and November of 2024. And the COG has been allocated, I guess to even, step back a little bit more, Addie said, the county receives $1.1 billion for homeless services and affordable housing. And this number at the bottom of your screen, 382 million plus, goes to this new county agency called the LA County Affordable Housing Solutions Agency. And they provide funding to eligible jurisdictions, as you can all see here, including the South Bay COG, to implement affordable housing production, preservation, and ownership programs, and also renter protection and homeless prevention programs. So we are mandated to invest in the production of new affordable housing, also preserve affordable housing, and to invest in home ownership. But we're going to talk about renter protection and homeless prevention today. Go to the next slide. And just really quickly, can you all hear me okay? I'm like peeking at my Zoom mic and it seems off.
Yeah,
Yeah.
we can hear you, Kevin.
Okay,
Yep.
that's good. Perfect. Okay, so going a little bit more detail into the renter protection and homeless prevention work that we do, we're allocated just over $4.8 million to implement these programs. And these programs include, doing some marketing to, doing what we're doing today here is, market the programs that we have, assess individuals to see what kind of programs they do. Addie mentioned some legal services, but today we're really going to talk about this prevention financial assistance programs that we have. And there's two buckets of funding. One is called the Emergency Rental and Financial Flexible Assistance bucket of funding, and that's a mouthful, so people call it the ERFA. And there's also the Temporary Rental Assistance. And if you're interested in how one would be able to be eligible for this program, there's really four main things. Is one, you must be considered lower income, and that means making at 80% of the area median income or below. And here's a chart that kind of dictates that and shows what the area median income, below and at 80 is in the county. Also, folks must reside in rental housing. It's the second piece of thing to be eligible for this program. As Addie mentioned, this is for folks who are housed. There's a little bit of some gray areas. What's nice is this bucket of funding is really flexible. And then, as I mentioned, that rental housing, the next thing is that folks cannot be experiencing homelessness or in the homelessness services system. So when I mentioned about the rental housing is that there's a bit of a gray area where if someone was paying out of pocket themselves at a motel, they would be able to access these funds to gain housing. But if they were staying at a hotel and that was being paid by the homeless services system like us, because that's one of the eligible uses, then they wouldn't be able to um, be able to access this funding. So it's really, they must meet the income requirement. They must live in a rental housing. They must not be experiencing homelessness in the homelessness service system. And also for rental housing, there's some informality too. So if you're couch surfing too, you could also gain access to these funds. And then the next piece is kind of really the main part is this bucket of funding is really for folks who are experiencing an emergency crisis or have experiencing any unexpected events within the past 12 months that has put their household at risk of losing their housing. So that could be anywhere from action of a landlord or property management, an eviction lawsuit, loss of income from falling sick, medical emergency, natural disasters. All you can see here, these are all the eligible, I guess, reasons why you would be able to get this pot of funding is that this is for emergencies. And then going into a little bit more detail, like what are the actual activities that you could participate in with this funding? So as you can see on the left, there's a lot of activities, it's emergency, it's flexible. So there's standard activities like security deposits, rental arrears, rental assistance, but there's also some more flexible activities like, move-in costs, relocation expenses, transportation costs, healthcare, food, even dependent care. Like if someone needed to get a job and needed to go to an interview, but they don't have someone to take care of their children, then this bucket of funding can pay for dependent care, so they can go achieve their job and gain income, so they can retain housing. That's really great. And on the right here, this is kind of a separate pocket of funding. It's just for rental assistance and utility assistance. It's a little bit in the weeds because, there's a, as Addie mentioned, we offer, and also the county offers a time limited subsidies program. So if someone was exiting that program or in it, they wouldn't be eligible for this large flexible bucket of funding. But if they are exiting, then they would be able to go for temporary rental assistance. But then, like I said here, that they would only be able to go for rental assistance or utility assistance, not any of these. And then moving on. So now you're probably wondering, how are I'm going to go into like, how do you access these funds? So we partner with three service providers, two nonprofits. You have the Watts Labor Community Action Committee, St. Margaret Center, and then the City of Gardena. The Watts Labor Community Action Committee kind of takes over the southern hub of the South Bay's jurisdiction. You see cities like Torrance. Oh, that's a typo. We recently just launched City of Gardena, which is great because they have an existing rental assistance program. So we're kind of supplementing their current program as they have existing infrastructure. So while we were waiting for the City of Gardena to go online, WLCAC was covering Gardena, but now it'll just be solely Gardena. And then St. Margaret Center, SMC, kind of takes the northern hub of the South Bay as Inglewood, Lawndale, Hawthorne. And then moving on, if you want to learn more about this program, you can head to our website. You can head to this, I guess, this domain, sbrenterprotect.com. It takes you to this page on our website. It goes a little bit more into detail about our program, the information, the eligibility and the income criteria that folks have to meet to be able to receive assistance, also the documentation that is required, and also all the applications for the service providers that I just mentioned. So this is really where folks can go to learn more and access assistance. This is where, if you are from the South Bay, you can get assistance. But Natalie so graciously shared where folks were coming from in kind of the attendee list. And while not everyone is from the South Bay, what is some great news is that the organization that is funding us, La Casa, is now going countywide. So if you go to lacasa.gov, that is their website, and then right when you get on that page, you'll see this beautiful person who looks like they're going to give you a hug. So you can click learn more. And when you click learn more, you're going to be taken to the page to learn more about the program. And then these are all the service providers that they are contracting with. You see this 1, 2, 3, 4, 5, 6, 7, 8, 9 providers. And as you can see here, some have different geographies. Some are countywide, some are only in the city of Los Angeles, and some cover certain service planning areas. And on the page, I think maybe about 4 or 5 organizations right now are live. So you can kind of click their name and they'll take you to this flyer to learn about how to get assistance with them. So I really wanted to share this, and I'm glad that they are up and running in time for this meeting because I know, everyone's coming across the county. So, this is a resource that is everyone in LA County. And then if you're interested in, what is the service planning area and where that is, this is kind of a breakdown. I'm sure we'll share these slides with you all afterwards, but 1, 2, 3, 4, 5, all the way through 8. It's kind of a breakdown of where those service providers are at. And yeah, those are the end of my presentations. We can go ahead and take some questions if there are.
Thank you, Kevin. Yeah, are there any questions?
There was a question in the chat from Janet saying, not in the homeless system, does that mean not receiving funds, or if they have a caseworker, then they don't qualify? And so, Kevin, you can correct me if I'm wrong. However, I think for my understanding is not in the homeless system means that you are not actively utilizing resources in the homeless response system. So like there's an HMIS where folks that are in the homeless response system are a part of. And so we can ourselves, like any other nonprofit provider, can go in to see if you're receiving like case management, but not like social worker, like case management in the sense of you are at a homeless shelter or you are living a transitional living placement sponsored by a nonprofit or the county, or you are in an encampment. But a good way to think about it is most folks, I guess broadly would be folks that are renting usually will qualify because they're housed, or folks that are paying out of a motel by themselves, or as Kevin mentioned, folks that are like couch surfing. I know that was like something that was really hard fought because HUD goes back and forth as to whether they allow that to be homeless or housed, depending on the year. So I would say those three are probably like your safest bet. And so it just the La Casa is very, very clear and explicit about the fact that they are a housing agency, not a homeless agency, because those rest of the $630 million are for folks experiencing homelessness. So they really don't want the like not the double dipping, but they definitely want that delineation of if you are homeless, you should be accessing the homeless response system. And if you are housed and you would like to prevent yourself from becoming homeless, you are accessing this pot of funds. So I hope that answers your question. If it doesn't, feel free to call me or email me, and I will try to expand further on that.
Thanks for clarifying, Addie. Yeah,
Can I just
you said it better
add,
than
can
myself.
I add or add something?
Yes.
Oh, I didn't know if you could hear me. Sorry.
No, all good.
Um, my question is for say, because you use an example where if they were paying for a motel out of their own pocket, they could
Mhm.
receive their services. If they have it, if they're awesome, but they were getting funds, they cannot. So I guess I'm really trying to understand, yes, they're in a homeless system, but now they've expensed all the funds that they could get through those programs. Would they still qualify with you all, or how does that work? Because just like somebody else just said, like they have to be out on the street, or they're in this in between, they're paying for it, but they don't have income. Like how does this, you know, how can I translate this for a client? I'm a doula, and a lot of my clients are in an unhoused situation. They've relied on Hopics, so their rent isn't being paid any longer because of the things in the reorging. I mean, they're in very compromising positions, and these are new. They have newborns plus
Yes.
multiple children.
Yes. So, thank you, Janet. And you cut out there a little bit for me. So if I misspeak, anyone correct me. So for folks, especially Jen in the situation yourself, for folks that were with Hopix, lost that funding, will no longer be able to pay the rent on their own, while they are still remaining in their house, in their housing, I would work very quickly to get them connected to a La Casa provider. If they're in our jurisdiction, I would even have you just like email me directly or Kevin directly, or those providers that you saw on the drop down, so that they will qualify. Because the moment that they leave their housing, then you'll have to go through the traditional homeless scary response system that we're all thinking of, right? Unfortunately, that's the reality situation, because like those funds are less flexible, way more rigid, and definitely I think perpetuate the experience that many people have had with the homeless response system. But while they are still physically housed, then they would qualify for the services that Kevin mentioned. It's when they are not, it gets really tricky. And there's lots of gray area. And unfortunately, I think it lessens a lot of their opportunities. If you come across someone that has exited their housing, right, and is now in a motel, right? Say that it's too late, they already got left out of their housing, now they're at the motel. If they are paying for the motel themselves, they would still be able to access La Casa funds. If they are not paying for the hotel and the city's paying for it, the county's paying for it, or a nonprofit is paying for it, then they cannot qualify for the La Casa services. They have to go through now the homeless response system again, because they are utilizers of the homeless response system. So that's kind of, and for me, I always suggest to people now, especially this past year, like if you're getting ready to exit, I would try my best to either pay for it myself. I know that that's a pipe dream, but I would do my best to pay for it myself so I could continue to qualify for these resources, or I would try and go to couch surf with family because, or friends, or chosen family, because that would still keep that qualification of housing that you would need to access the cost of money.
Is that helpful, Janet?
I think so, but because I'm not fully versed on this, my clients are kind of telling me things from their perspective. But yes, it'll continue to further once I get the slides and I can kind
Yes.
of share with them some of the conversation that we're having. It'll help, and I'm definitely keeping your email address, Addie.
Please
So
do. And where are you
definitely
located?
know you're going to hear from me.
Absolutely. Where are you located?
I'm in Los Angeles.
So LA City.
I'm in Los Angeles, but I have one mom with yes, I have one mom who has five daughters. One is a newborn, and she's in a motel. She's expensed all of her funds. I have another mom who, like I said, was getting money through Hopix. And she's been paying her portion, but Hopix has not. So she's she's being harassed by the landlord and in great stress. I have another mom who was staying with her grandmother, and she opted to be in a shelter with her newborn baby. First time mom. Like, I have very different situations, and this is like daunting for me because
Yes.
even for ourselves, even with full income, housing is an issue for most of us.
Yeah.
So I couldn't imagine having a newborn baby in these situations.
Yeah. No,
Janet, both of those cases are familiar to me and have come across my desk in the last week. I just gave an overflowing cornucopia of resources. I'd be happy to share those resources with you for those two families and connect with you more about them along with Addie and Kevin.
sounds good. Thanks, Yvonne. Thank you.
So
Much
helpful.
appreciated. Thank you very much. I'll put my
Yeah.
email in the chat.
Thank you so much, Janet, just for for the work you do, right? Like supporting and babies as they're, trying to secure more stable housing. So just expressing my gratitude to you and so many folks that are on the call. I have a question just about, I think probably a lot of folks on this call are working with families. Yeah, like Chantel just said, working with a lot of families that are facing housing insecurity. And, it can be tough to like navigate and figure out where to start sometimes. So, Addie, you mentioned like, if folks are within sort of the South Bay region, they can maybe reach out to you all.
Yeah.
But I'm curious, like, so for example, for my doulas who are on the call, and there's obviously different folks in different regions. How do folks know where to start? Like, what would be sort of step one, so to speak? And then I'm also curious just about like, is there something that's easily accessible so that as our amazing birth workers are supporting families, they can have something that is tangible, something that they can give to folks, or like just something to make that happen.
Yeah. So and Kevin, you can correct me if I'm wrong. I personally, because there's such an overwhelming amount of information, as I mentioned earlier, and it's all like disjointed in 14,000 different places. Me personally, myself, I would start likely at the SB Renter Protect website that Kevin can drop in the chat. There is a more comprehensive, like, explanation and description of the program, the resources that are available through us. And then if you don't qualify because you don't live in our jurisdiction, like an email, a phone number to where you can start calling and asking and going through their process of accessing this resource. So like, and Kevin dropping lacasa.gov is who is the funder. I would say, like Kevin is saying, there are we all have this money, right? So the same way that we're sitting here doing this presentation and have these resources for families and people in our jurisdiction, everyone in LA County has their own version of this pot of money. The thing with us is we just worked really hard to get this online for the people in our community, and we're trying really hard not to get bogged down the bureaucracy of it all and all the red tapes and all the million hoops you have to jump through. So our program has actually been online since October or November. I know that LA City, Kevin would know more. He's in more of these meetings, probably came online very, very recently. And so we've had many months to work through a lot of the kinks, make sure our providers are doing what they need to do, carve out those documents, make our guidelines and program manuals. And so I know that doesn't help everyone in LA County, but you will get a good idea of what you're going to need to access any of those programs from our website, right? The median requirement is going to be the same across areas. The documentation requirement is going to be the same across LA County. It's just whether or not those specific jurisdictions have set up their programs yet, as of yet. And so Kevin has shared, right, that some of these have come online really recently, and so there's information on those partners on our website. But I would start, if you're pressed for time, I would start on our website, figure out what it is, what you need, and then go from there. Again, if you're part of our jurisdiction, we have our partners that we're providing with. So like Watts Labor, right? And then St. Margaret Center, both in our northern hub. And so we pay them to be able to help the community and pay these arrears and do this emergency assistance, X, Y, Z, and the 13. So again, I know that for LA County, that's a bit rough and it feels, not super cohesive. And, we agree with that. But it was really important for us to get moving and be like, folks need this money, they need this help. And like, we're going to work triple time to make sure that they have access to this. So I would say our website is very helpful. And then if you want a bigger understanding of the funding source itself, the lacasa.gov email address that Kevin dropped in the chat, I would say is a good place to start, because it's a new resource, right? This just came online this fiscal year. So just like we're all learning, like if we are in the middle of all this, and we're still learning, so our providers are definitely not caught up on all the resources that are available. And so that makes sense. But this is really exciting, right? Especially for folks in our jurisdiction. It's super exciting because it would solve a lot of the challenges that you all have shared, right? It would solve a lot of the precariously housed, housing insecurity, instability piece. And it is unfortunate that, not every jurisdiction is online quite yet. But I know that they're working really diligently to come online. And then Dana, these they're in perpetuity, so they're indefinite. The only way that they wouldn't be is if voters recalled the measure, but I don't anticipate that happening. So they're in perpetuity. But it's brand new, so a lot of people don't know about it, which is why you're probably still getting you need to be on the street. Like you don't actually, and I would prefer you guys not to be on the street. I think it's super inefficient and counterproductive and obviously like perpetuates harm and trauma. So I would encourage folks to stay housed and access these resources, but I also understand that not every jurisdiction is online right now.
It's really amazing. Like, yeah, I feel like I don't know that a lot of us understand or understood like what this looks like. So just really grateful for this information. It's amazing. I'm curious because I saw Curly had a question in the chat. Obviously this particular measure is specific to LA County, but I am curious, like, how would folks see if there's sort of like a parallel type of measure that has happened maybe in other counties or other, Southern California or even Northern California counties? Like, how do folks start with that?
Honestly, I Google. It's so funny. Kevin and I talked about this coming on this before this meeting because Natalie mentioned that obviously we're going to get a variety of folks like from IE, Orange County, and I know that, like, for example, in Northern California, Santa Rosa has Measure O. I know that in Orange County, or maybe it's the reverse, and then Orange County, they have a different measure. I would probably Google, right? Like, I would be like, what is the homeless? Because even our own cities within our jurisdiction have additional homeless tax measures in their specific cities, like Torrance. Torrance is one that adds on top of the tax to fund their shelters, their outreach. So I usually just Google and I'm like, does this county have a homeless tax measure? Does this city have a homeless tax measure? And then if they do, right, I click on that measure, I click how they're distributing funds, and then what those funds look like, right? If you Google right now, like, does LA County have a homeless tax measure? Measure A comes up, it tells you how it's distributing those funds. 2/3 are going to homeless services, 1/3 is going to housing and production. Then you follow that housing and production, and then you have these resources. Right? But it is really convoluted and it is a lot of information. But I would start with the typing of, do we have this a homeless tax, measure in my jurisdiction or my county or my city? And then if we do, what does it go to? What are the services that it funds? I think, Kevin, when I looked, I don't know that Riverside County or San Bernardino had one, but I could be wrong. I don't know if you were able to find anything.
Yeah.
Um,
I mean, we could look a little harder. I did an initial search and didn't find much.
okay.
But yeah. Natalie, I mean,
Mhm.
I want to be conscious of everyone's time. I know
Yeah.
Yvonne has a great presentation
Yeah, I
to
want
share
to
with
turn
us.
it over
So
to Yvonne.
any
Yeah.
more questions, Addie and I are an open book. Please email us and we want to help you guys. So I
Yeah,
will
thank
start
you.
sharing Yvonne's presentation.
And we mean it. You can actually email us. We're going to respond to you.
Oh, Yvonne, you're muted.
Thank you, Kevin. Thank you, team. That was a wonderful presentation. I hope that that was helpful to you all. My email address is right down there on the bottom. I work alongside South Bay City's Council of Government under Hero Services. This presentation, I work as a CalAIM Medi-Cal Medicare consultant. So any navigation that doesn't go directly through accessing funding and support services generally through the COG comes with me when it comes to Medi-Cal, access and navigation. And so that's my navigational support. I've been working in public health and education for over 25 years, and my wheelhouse is primarily families, but I spread out kind of all over wherever I'm needed to support all of our cities in Service Planning Area 8 and our community-based organizations. I do bleed over quite a bit into 6, and I have resources all throughout Southern and Northern California. I'm originally from Sonoma area, and so I'm willing and able to support you in any ways that I can. So please don't ever hesitate to reach out with me. Next. So, enhanced care management. What is enhanced care management? So, enhanced care management, if you have Medi-Cal, and even if you don't, we can help you sign up for Medi-Cal or Medicare or dually for both if it's appropriate. And what are some of the services that can support you by being referred over to enhanced care management? It's a higher level, it's a higher touch of support for members who qualify for these services. So if you need medication management, if you need transportation, if you need a special diet, there are certain health plans that will help with postpartum up to 12 months if medically needed for postpartum dietary supports, asthma remediation, residential modification if needed. They can meet you on the street, they can meet you in shelter, they can meet you in a resource center, they can meet you in your home, wherever it is that is needed to support you in navigation through this higher level of enhanced care management. Next. What is the criteria? What would help you go through the navigation of enhanced care management? Are you on Medi-Cal? Are you receiving services through the Department of Mental Health, which means are you med compliant? Are you seeing someone for supportive services? Are you going to groups? Are you linked in with Department of Mental Health and any of their services? And are you compliant with them? Or SAPSI for drug and alcohol supportive services? Do you have any chronic health, physical, or mental conditions in our state and county supportive services or developmental or intellectual needs? Are you pregnant or postpartum up to 12 months? Are you unhoused as defined by HUD, which is literal homelessness meant, or are you in an environment that is not conducive for human habitation? Are you in imminent risk of being homeless? So you heard earlier some talk about couch surfing or being in arrears for rent. Is that an indicator for you where we may need to send in a referral for enhanced care management for you? Are you at risk of being unhoused within 14 days, or are you at risk of fleeing a domestic violence environment? Are you a transitional population? Are you transitioning out of post-hospitalization, foster care, incarceration, recuperative care services? If you were supporting somebody who has any high needs, and you have gone for supportive services for yourself and you're transitioning out of that, or in any type of congregate living. Next, please. And who are these populations that can come into these services, who we can support navigate under Medi-Cal, Medicare, or D-SNP dual services? There are any adults, unaccompanied youth, children, or families who are experiencing being unhoused. Any of those above populations trying to avoid the hospital or are frequently flying in and out of the revolving door or of urgent care or hospitals? Is there a mental health or substance abuse disorder need? Can we help you navigate that? Do we have a child or a family involved in the foster care or child welfare system? Are you transitioning out of incarceration that we can help you navigate support services? Are you at risk of long-term care institutionalization? And are you a nursing facility resident that is transitioning out of this facility back into the community? Next, please. So, what are some of those community supports under enhanced care management? So, if you have Medi-Cal, that's your top umbrella. Under Medi-Cal or Medicare or both, if you are aligning with both, you will qualify for underneath that umbrella for enhanced care management and or community supports under a housing trio. So we have our top umbrella and then we have multiple buckets underneath those, community supports and housing trio. What does that look like? So how can we support you in those buckets? We have housing transition and navigational services. And these community members that are experiencing homelessness or are at risk of homelessness can receive help. They can apply for and receive navigation for housing. So we at the COG, we work with several community-based organizations. We work with outreach workers, and we can help you in navigating those services. We have case workers that will help you. We have housing deposits. So members may receive assistance for security deposits, utility setup fees, first and last month's rent, first month's utilities, and members can receive funds for medically necessary items like heaters, hospital beds, poles, commodes, whatever is needed to support you in the home to accommodate your needs within the home. And that is paid for and supported through healthcare navigation. So that funding is not coming from the COG bucket of money that Addie and Kevin spoke about. It's coming from the medical side of it. And that's where I'm helping you navigate and the outreach workers and the community-based organizations. And then we have housing tenancy and sustaining services. So this support helps you maintain stable tenancy once the housing is secured. That coordination, I saw a question in the chat. Did those checks go directly to the community members and the families? Those checks are cut directly to the landlords or the whoever is navigating and supporting the renter. So that's the landlord. And so that assistance is annual with their housing recertification process. We can help you with that. And we link you to community resources to prevent that eviction. So we will talk to the landlord. We will negotiate with them to prevent you from being evicted. Or if you're in arrears, we can try and work with them. And same with utilities. And then underneath that bucket is another bucket that hasn't been completely rolled out. They're in negotiation with it on how the navigation will help with the rollout. And that is called transitional rent, and that will cover up to 6 months rent for members who are experiencing or at risk of being unhoused that meet that eligibility. So transitional rent is designed to provide a time-limited opportunity to help a member who is exiting homelessness that may no longer be at risk of entering into homelessness and to establish that bridge for permanent housing. There are a couple of caveats that can take away from those expenses, like if you've been in a skilled nursing facility, for example, or an assisted living facility, those funds will be evaluated and that will be deduced from the transitional rent. But each case is individual and we're looking at that and we're vetting it. Next, please. Where can you go for support with enhanced care management? So here's a list of resources. These places will help you get into enhanced care management, whichever is one of your healthcare plans. The big ones in LA County, it's LA Care, Blue Shield Promise, which is the Medi-Cal component of Medi-Cal in California under Blue Shield, Health Net, Molina Scan. So there's multiple different ones and they can help you. So Beach City's Health District in Redondo Beach, they can help you, and that's their address and their phone number. Lutheran Social Services of Southern California, Magali and Wendy are very skilled and very good for navigation. And then there are 3 community resource centers in Service Planning Area 8. It's the only spa service planning area to have 3 community resource centers in Wilmington, Long Beach, and Inglewood, which tells you that Health Services recognizes the magnitude of the need in Service Planning Area 8 so much that they put in 3 resource centers. There are a total of 14 across Los Angeles County, as down south as Long Beach here for Service Planning Area 8, and all the way up through Lancaster. And 100% of those services within those resource centers is 100% free, and they can sign you up regardless of your insurance plan to Medi-Cal, Medicare, or enhanced care management. And then we also have Family Promise of the South Bay and Torrance, and their phone number is below. Any questions about, again, I've got 1 minute. And I will put, Kevin, if you can come back to the very first slide where my email address is, that will pull up. There we go. Thank you so much, Kevin. Any quick questions?
Any questions from anyone? Feel free to just come off mute and or put it in the chat.
And while maybe folks are thinking of questions, like I would really encourage folks to look into this. It's like it's obviously state funded, right? Through the governor's office, through Medi-Cal. It requires all of these providers, Kaiser, Molina, Blue Shield, Blue Cross, to connect folks to services like housing deposits, like housing navigation, like temporary rental assistance. So it's yet another door that we can all knock on to ask for support or resources. It's like a very, very, I think, underrated resource. Not many people utilize it or access this because they simply don't know. But it's
Exactly.
definitely another avenue that we can all pursue when we're trying to support the families that you all are advocating and empowering.
One of the
Yes.
first things when community members, my wheelhouse, as I mentioned, for 25 years, health and education is families. And when I have doulas, midwives, maternal health workers reach out to me and ask me for supportive services, the thing that I ask is, do they have Medi-Cal? Do they have health insurance? And if they do, then what's the name? What's their Medi-Cal number? What's their phone number? What's their date of birth? So when you email me, those are the things that I'm looking for from that community member so I can help navigate funding and supportive services for whatever it is that they're needing.
I love it. Thank you all so much. This is our first time as an organization doing something like this. And the goal again was to really provide resources and connect the workforce that we know and work with directly to the amazing work that you all are doing. So we'll share the recording, we'll share the information out with folks, and just hope this is the first of many kind of bridge building opportunities for us to collaborate more deeply in the birth justice space with folks who are doing amazing work in the housing justice space. So thank you all. And if there's any questions, I did put an evaluation in the chat just so we know like your takeaways to see if this is something we should continue to do as a coalition. But with that, I just want to thank Addie, Kevin, Yvonne for your expertise, your time, your knowledge, and everyone else